Welcome back. In this video, we'll talk about calcium channel blockers and amlodipine. This medication is available at 2.5, 5, and 10 milligrams, and it is perfectly safe for patients with renal impairment. Patients with liver disease, however, have to start with the lower dose, 2.5 milligrams, and gradually increase to reach the optimal state. It's mainly used for hypertension, to adjust the blood pressure, and for angina or coronary artery disease. If the indication is angina, we tend to use the upper dose, 10 milligrams. The main side effects that we see in patients is edema. In fact, about 1/10 of the patients have this side effect. The patients will start noticing that their shoes or gloves no longer fit them. Other less common but also present side effects include headache, fatigue, palpitation, dizziness, and sometimes abdominal pain. These side effects are present but not very common. There are some serious but very rare side effects, and these include arrhythmia, peripheral neuropathy, anorexia or constipation, and allergic reactions. Because the drug is metabolized by the liver, it is affected by anything that affects the liver. So the dose has to be corrected if the patient is taking medications that affect cytochrome P450. The drug also interacts with dantrolene and sildenafil, as it might cause hypotension, statins, specifically simvastatin, and immunosuppressants. The drug is perfectly safe for patients who are pregnant. Although we don't have any significant evidence for its safety in pregnancy, the risk of hypertension in pregnancy is very serious and well documented. So we outweigh the risk of having pregnancy hypertension with the risk of maybe having some side effects of amlodipine in pregnancy. In other words, it's safe in pregnancy. There are very clear evidence that amlodipine can be present in the breast milk in lactating females, but there are no evidence suggesting harm to the infant. So, lactating females are perfectly safe to take this medication. The medication works by blocking calcium channels. That's why the class is called calcium channel blockers. The smooth muscles that form the vessels need calcium to contract. So if they have calcium, they will contract. And if they don't, they will relax. Calcium channel blockers basically block the influx of calcium, and this results in dilatation of the arteries and more blood flow. Now for some pharmacokinetics. The drug has bioavailability of about 65 up to 90%. The onset of action is from 1 day to 4 days, and a single dose stays active for about 24 hours, while the plasma peak is reached in about 6 to 12 hours. It is bound to protein in about 90%, and like we said, is extensively metabolized by the liver. Thank you so much for watching. Hopefully this helped you in some way. And if you like this video, you can learn more by watching the medical courses I have in the video description. Thank you guys for watching, and I'll see you guys later.